This is Dr. Vinila, Consultant Pediatrician at Treatment Range Hospital. Today our topic is fever. So what is fever in children? Let's go to the definition. The fever is the temperature which is more than 100 degrees Fahrenheit measured in the oral cavity, or more than 99.5 fever measured in the underarm. So what are the causes? What are the causes of the fever? In children, mostly the common cause can be viral fevers because they are most notorious and they spread easily from children to children when they are going to the schools, from the siblings. So the most common cause can be viral fevers. The other causes can be mostly throat infections, or the children is having ear infections, mostly the tummy infections. And these are the few which are most common in the children. There are others also, like according to the season flu or the dengue, malaria. All these can also be the causes. So presently, after the child is getting fever, what are the things we have to do at home? So what we can do is the fever medication, then providing the good hydration, providing the good sanitary conditions to the child, and fever medication is the most important thing, along with the good hydration, is the one which causes the fever to subside in the children. So coming to the fever medication, what fever medication we can use it at home is only paracetamol. That is also the dose which is given by the pediatrician is the safest thing. Along with that, good hydration. You can give any hydration like ORS or lassi or anything, or ORS like, not the Tetra Packs, only the ORS sachet which can be mixed with the water, or the lemonade, whatever the child likes. And so next when should you get the child to the hospital, or when you should see the doctor? So if the child is having fever more than 102, 103, which is not responding to the medication, the child is cranky, or the child is lethargic, not eating anything, the child is having reduced urine output, or the child is even rejecting the liquids also, and the fever is not subsiding. These are the conditions where you have to see the child and get to the hospital. The other things which you can do at home is, when the child gets fever, do not keep them in so many layers of clothes. It's just a simple cotton clothing which you can put them, because what happens in the fever is the water get evaporated. So the child, we should not prevent that. We should keep the cotton clothing properly, one layer of clothing which is sufficient, and it should be a breathable fabric for the child. And whatever, avoid cold foods or outside foods, especially make the child only home cooked food during the fevers are very, very important. And what are the things the parent should not do? The thing which the parent should not do is taking the antibiotics, self-medications. Do not consider, please, don't take self-medications. You should always, while taking the antibiotics or giving it to the child, consider the pediatrician immediately. Do not take the self-medications. If the child is having fever, you can give paracetamol whenever the child is having more than 100 degrees Fahrenheit temperature. If the child is having, if the child is having 99 to 100 degrees Fahrenheit, you can sponge the child with lukewarm water. Not the cold water or very hot water, it's just a lukewarm water. You can rub the child and sponge the child. So for the time being, the fever will come down. And we should give the fever medication you can give every 6 hours, which is a maximum. But it is not to be given like round the clock, 6 a.m., 3 p.m. It is not like that. Whenever the child is having fever, then only. So the things which you should avoid is giving continuous the paracetamol, or giving in 4 hours, 6 hours, or self-medications. That should be prevented by parents. So kindly please take care so that you don't self-medicate or over-treat the child. It should be the pediatricians who should treat if the child is having any other. Because the fever at times can be symbolized some other things which should be completely taken care by the pediatrician only. And hope this video is useful for you. Please try. If you have anything, we are available 24/7. Please come and consult us at the Treatment Range Hospital. Thank you.